Hi everyone, this is Dr. Shim Ching from Honolulu, Hawaii, board certified plastic surgeon, talking to you today about a facelift. What is a facelift? Why would you want a facelift? Some important advice about this procedure and what you need to know if you're interested in a facelift. As somebody who's had 20 years of experience with this procedure, I'd like to share some advice about anybody who's considering a facelift. When I talk to patients who are interested in a facelift, usually that means they want their face to look younger. We tend to call that procedure facial rejuvenation because the face with plastic surgery really means this area. There are other parts of the face that age. For example, the neck and the eyes, the eyebrows can droop, and all those are in a more comprehensive procedure that I like to call facial rejuvenation. When we talk about a facelift, I'm really just thinking about this area, which is what we call the face in my field. The typical reason that a patient might be interested in this procedure is that they feel that their face is sagging. This line, the nasolabial fold, as well as this line, what we call the marionette line, is quite deep. And then they just feel that their face is lower than it used to be. They may have a little bit of what we call a jowl, some heaviness here. And what I usually want to address is the face sort of being too low. Usually the cheek is most prominent here, and the prominence of the cheek can shift down lower, again making a patient look older than they want to be. These are all natural features of aging. As we age, the face sags, and the goal of the facelift surgery is to reposition the anatomy of the face into a configuration that looks younger and is more like the anatomy when the patient was younger. So you can think of your face as skin, and then there's a layer underneath the skin called the SMAS layer, which is the foundation layer of the face. And then underneath that, there are muscles, glands, nerves, things that we can't really touch. To lift the face, the first thing I was tried maybe about 150 years ago was to lift the skin off of the face, pull it back, cut out the extra, and then sew it back down. You have to remember that when we're younger, it's not like their skin is really tight. And just tighten the skin of the face of a patient really makes the patient look unnatural, they look pulled, they look too tight, and it's a very unnatural procedure that we tend not to do anymore. So most surgeons will avoid what we call a skin-only lift because it doesn't work. For this reason, it looks unnatural, results can be short-lived, and then the scarring can also be worse because there's so much tension on the skin. Instead, we're lifting that deeper layer to the skin, the SMAS layer, and SMAS stands for submuscular aponeurotic system. And I feel this is the only layer that we should be trying to lift when we do a facelift. Now, there are many ways to deal with that layer to lift it into a higher position. Of all the techniques that I've encountered and studied over the last 20 years, the best technique that we have today is called a deep plane facelift. Plane refers to the level at which we're doing surgery, and the level deeper to this layer is really the correct layer that we should be lifting. The other aspect of a deep plane facelift, or how I do the deep plane facelift, is that the face is lifted all the way to this line and this line. Older techniques tend to try to lift the face all the way over here, so the pull here is not quite as direct because we're not lifting the face all the way to these lines. Some techniques only plicate or sew together that deeper layer. And you have to remember that the face is strongly attached to all the things underneath, or else our faces would just sag completely and everyone would look old right away. It's really necessary to divide all these attachments so we can reset the anatomy in a higher position. We believe all these attachments stretch over time as we get older, so by detaching things and lifting things in a higher position, that's really the best way to deal with aging. If we do that, patients are going to have the most natural, the most long-lasting, and the best results. And that's why I strongly believe the deep plane technique is the best way to do a facelift currently. Unfortunately, I do see a lot of patients who come to me for what's called a revision facelift. These are patients who had a facelift elsewhere and they're just not happy with the results. They didn't see much difference after their surgery they had before. And it's a real shame to go through this procedure and not get the result that you want. In these patients, what I do is I do this deep plane technique. The full lifting of the face all the way to this line and this line here, and that usually resolves the problem. Just by doing the right thing in the right patient, we can get a much better result. And because I know what technique was used previously, and it almost wasn't the way I do a facelift with this deep plane technique, the results speak for themselves, and that's how I know this technique is better. So if you're considering a facelift, please seek a skilled and experienced plastic surgeon who's very comfortable with this procedure. I would ask him or her, how is the facelift done, what kind of technique they're using, And even though the D-plane technique is what I'm talking about, one person's version of the procedure may be very different. So it's important to ask questions to try to figure out how exactly your surgeon is proposing to do your surgery for you. If you like this video, please give us a like down below, give us a comment, subscribe to our channel, and we'll see you next time.